Noonan syndrome. Noonan syndrome is a genetic disorder that prevents normal development in various parts of the body. A person can be affected by this syndrome in a wide variety of ways. These include unusual facial characteristics, short stature, heart defects, other physical problems, and possible developmental delays. In 1962, pediatric cardiologist Jacqueline Noonan was the first to discover and describe this condition in both sexes. She identified 9 patients, which she presented a study for to the American Journal of Diseases Foundation. The eponym Noonan syndrome was adopted in recognition of Dr. Noonan. What is the incidence and prevalence of this syndrome? Noonan syndrome is caused by a genetic mutation and is acquired when a child inherits a copy of an affected gene from a parent. It can also occur as a spontaneous mutation, meaning there is no family history involved. Noonan syndrome is characterized by marked variable expressivity, which makes it difficult to identify mildly affected individuals. The incidence is 1 in 1,000 to 2,500 live births of severe phenotype, but mild cases may be as common as 1 in 100 live births. There is no known predilection by race or sex. The diagnosis of this syndrome can be made on the basis of clinical features, but may be missed in mildly affected patients. Molecular genetic testing can confirm diagnosis in 70% of the cases and has important implications for genetic counseling and management. Here are some of the clinical features of Noonan syndrome, which include hypertrophic cardiomyopathy, nystagmus, hearing loss, feeding difficulties, lymphadenema, leukemia, among others. Signs and symptoms of Noonan syndrome vary greatly among individuals and may be mild to severe. Characteristics may be related to the specific gene containing the mutation. In regards to learning disabilities, intelligence isn't affected for most people with Noonan syndrome. However, individuals may have an increased risk of learning disabilities and mild intellectual disability, a wide range of mental, emotional, and behavioral issues that are usually mild. Hearing and vision deficits may complicate learning. Other neurologic symptoms may include central nervous system malformation, early motor milestones delay, and speech disorders.
Long-term effects and prognosis. A person with Noonan syndrome may not exhibit all of the symptoms or may exhibit them to various degrees. The majority of the Noonan syndrome children have normal IQ, but around 1/3 may have a minor intellectual impairment for life. The majority of the children with Noonan syndrome have cardiac abnormalities. If severe cardiac abnormalities are absent, a person with Noonan syndrome has a normal life expectancy. However, since birth, almost half of the persons with this syndrome have had a cardiac abnormality, such as a hole in the heart and stenosis. Noonan syndrome is characterized by delayed puberty in adolescent boys. They begin puberty at the age of 13 or 14 and have decreased pubertal growth spurts, resulting in shorter height. The majority of boys with this syndrome have undescended testes, which can lead to infertility and the inability to father a child later in life. Females suffering from Noonan syndrome may experience delayed menstruation. Noonan syndrome has been linked to a number of bleeding problems. Following an accident or surgery, some people may have severe bruising, nosebleeds, or persistent bleeding. Women with Noonan syndrome who have had bleeding problems may experience heavy bleeding during menstruation or even in delivery in rare cases. Clinical interventions based on disability and scientific literature. Individuals with disabilities have demands that are similar to those of the general population. Nevertheless, a person with disabilities typically have requirements that go beyond the standard services offered to non-disabled individuals. They may require one-of-a-kind specialized support services which are available through state and federal programs. Clinical management focuses on cardiology, therapy and follow-up, growth and development monitoring, and symptomatic treatments as needed. Annual development evaluation starting in the second half of the patient's first year of life or at diagnosis. If the test findings from the annual development evaluation are abnormal, the best course of action needs to be evaluated. At the start of elementary school, a basic neuropsychologic evaluation is performed. A child with Noonan syndrome who's having difficulty learning might benefit from an educational program. Many children with this syndrome struggle with speech and language. Working with a speech therapist before issues arise might help to mitigate their severity. Early intervention is a program that provides assistance to children with developmental impairments or delays, as well as their families. EI's purpose is to guarantee that families with children aged newborn to 3 who have documented impairments or developmental delays or are at risk of experiencing major delays receive services and supports to help maximize their child's development.
Noonan syndrome disorder is multi-system disorder. Because it's multi-system disorder, people need specific tests, assessments, or intervention. They are specific for individuals with the ABA. So, management of the Noonan syndrome disorder, it really depends on very specific signs or symptoms based on the client or a person. So there are some different treatments, and some of them are very generally standard, but they are not general treatments for everyone. Why? Because it's very different in each person's. So there are some guidelines that makes this syndrome disorder at very in various 4 stages. One of them is infancy, the second one is childhood, adolescence, and the last one is adulthood. And most people with Noonan syndrome disorders, or maybe at the ASD fields, need very social skills management supports, motor skills supports, or they want to learn independent skills or language skills supports. With treatment, we can teach them how they can individually learn these things and make them independent in the society. So ABA can help people who diagnose in various interventions at maybe clinical settings, school settings, home settings, and if a child or maybe if a person needs very special supports at settings, and there is a support, and it's individuals education plans or IEP that are for kids or children who need specific supports at schools. And with some specific therapies in clinical settings or maybe in home settings, we can treat these people and based on very effective interventions and assessments. There are some resources for people who need very more information about Noonan syndromes or other syndromes. And some governments and settings really supports people with ASD or Noonan syndrome disorder. Based on those governments and those countries or maybe settings, people with ASD disorders such as Noonan syndrome disorders support by government, and they get fund from government to maybe go to clinical settings which are very expensive, or IEP that can be expensive for some families and parents, and governments really supports them. And there are Noonan syndrome foundation settings that provides many informations about Noonan syndromes, and Ross Opathi's net resources is available for people that they can reach out to them and ask any question they want, and maybe read some specific articles in this website, and get many information and more information about Noonan syndrome disorders.